I'm wondering whether we can touch a little bit on what people can do when they are potentially exposed to traumatizing events such as working in ICU or just general reaction to what is happening in our life.
This might be a good opportunity to talk about what we call the 5 pillars model of trauma-informed care, which, there's good evidence to suggest that if people are able to implement these 5 pillars within an organisation, that this can have a significant impact on recognising trauma, pointing people towards the help they need, and again, reducing the risk of people being traumatised in the first place and being re-traumatised. And these 5 pillars are collaboration, empowerment, safety, choice and trust. Collaboration is primarily about education, so it's about giving people the tools to recognise trauma and to help them find the help they need. But it's also about co-production of services with service users, other initiatives such as reverse mentoring, where say Band 2 and Band 3, often healthcare assistants from ethnic minority backgrounds, will mentor very senior managers within the NHS, and their lived experience will help in the design of much more compassionate and inclusive services. Empowerment is about reducing the amount of shame that people feel when they're asking for help. So if you can facilitate people's access to mental health, give people the space so that they can feel listened to and they can feel supported. It's really important. You touched on shame earlier. If people can feel that shame is understood and acknowledged and isn't judged, then people may then feel that they're able to look for help and have that shame recognised.
And that very much touches on the point of how do we create psychological safety in the workplace? How do we create psychological safety between us so we can openly talk about, what our experiences are? And again, not to diagnose, not to pathologize, not to do something about it in that moment, but just to create some safety for that conversation to unfold, and then have a think about how staff potentially can be connected to different services.
Absolutely.
Where they can get specialist support.
Absolutely, and that safety, it's psychological safety as you were talking about, and that can also be important in virtual spaces, making sure people feel safe when they're online. When you're seeing small faces on a screen, it can be really hard to notice whether somebody's triggered, so it's having space, having breathers, having breakouts where people feel they can take a moment, they can move away, take a breath if they are feeling that something's difficult that's coming up for them. And also in the physical design of office spaces, of clinic rooms, of waiting rooms, so that there's both physical and psychological safety. And this leads us on to choice, which is the 4th of the 5 pillars, and that's really about giving people the choice to get the support they need from where they need it. If somebody's being bullied by their manager, it's really not ideal for them to be seeking support from that manager. They're going to feel that's not a transparent and a healthy way to get what they need. So it's about looking for support from other teams, looking for support, mentorship, or role models from the same cultural or ethnic backgrounds, if it's a member of an ethnic minority. So giving people that choice, again, it helps them feel more empowered so that they can access the support. And if all of these 4 pillars are implemented well, then that's going to lead to increased trust in the workforce. And that can also be reflected in developing transparent communication, so people feel that if people do need to raise a grievance, or if there's a disciplinary, people feel that the system is clear, transparent, and is not biased against them in some form. And there's a lot of evidence to show that if these 5 pillars are implemented effectively, then that leads to a happier workforce, better morale, and better patient care, etc. So it's really important.
And that is talking more about what organizations can do to support the staff and how they can use that 5-pillar framework to think about the different processes and some governance around this as well.